Dr. Danny Angerbauer compares the Mediterranean, mind, and ketogenic diets, exploring which diets have the strongest evidence for supporting brain health and preventing cognitive decline.
So, how do sugar and carbs kind of play into the nutrition picture? I think if we zoom out and we just say nutrition in general, what makes a healthy diet? And when I first actually got into into medicine and was, studying nutrition and exercise, even in college, I had this question: what is the healthiest diet for humans? And it took me a number of years to realize that that's just a bad question. There's no such thing. I wish there was. I wish it was easy and we could just tell everyone just eat this. But people do better on different diets and maybe even at different times of their life and in different states of health and disease. So it's somewhat complex, but there are a couple baseline things that are important, I think, for everyone. So one is a focus on eating real food or whole foods. So everyone across the spectrum, carnivore people, vegan people, keto, paleo, vegetarian, you name your nutrition tribe, they will all agree that eating whole foods is the way to go. So that I think is probably the first principle is trying to eat foods in their, whole and unprocessed form as possible. The second place that I go with nutrition is what diet can you or what nutrition plan can you stick to that helps maintain your body composition, so your muscle mass and your body fat, as well as your metabolic health, your blood pressure, your blood sugar, insulin resistance, things like that. If you're on a diet that is helping you optimize those things, which we know play a role in every type of disease possible, even in the brain, obesity, hypertension, prediabetes, diabetes, these things all seem to fast forward cognitive decline. So I think that's kind of the first things to look at is stick to a diet that can help you maintain those things and try to focus as much as you can on whole foods. Then now, with that being said, now we can step into the realm of, okay, we can ask the question that doesn't have an answer, but it's fun to talk about anyways. What is the best diet for brain health? And I would say, if you just Google right now that question, what is the best diet to prevent or treat cognitive decline? It will come up and say Mediterranean diet. And I tend to agree with that. What is the Mediterranean diet? It's a diet of fruits, veggies, nuts, seeds, legumes, whole grains, moderate consumption of eggs, lean meats like chicken, dairy, and then minimal consumption of red meats. And of course, the thing everyone always thinks about, or the two things people think about, moderate red wine. Technically, that is part of the Mediterranean diet, and olive oil as the main source of fat. So that's what makes up a Mediterranean diet, more or less. And yeah, I said if you type that in Google, but if you also go through PubMed and all the research studies, whether it's observational or randomized clinical trials, that does seem to have, it doesn't seem, it does have the most evidence for preventing and potentially even treating cognitive decline. So that's probably hard to go wrong if you kind of focus on there. Oh, and I forgot one other piece to it is fish like 3 times a week or more. So the omega piece is probably a key component of that. So Mediterranean is probably tough to go wrong on. There's a couple others. The mind diet is basically Mediterranean, but they've added a component from what's called the DASH diet. But what I tell patients is the mind diet is pretty much a Mediterranean diet that is a little more specific on a few things that may have specific brain health benefits. And so a couple examples of those are the Mediterranean diet says eat a diet rich in fruits. And the mind diet will say specifically eat berries, one serving of berries every day. the Mediterranean diet says eat a diet rich in vegetables, the Mind diet will say specifically get 1 cup of green leafy veggies a day. And in addition to that, focus on other veggies. So they're just a little bit more specific. The Mind diet also says specifically avoid sugar, fried foods, butter, cheese, and there's a fifth one that I don't remember off the top of my head. Evidence for the Mind diet in terms of preventing or treating cognitive decline is not quite as strong as the Mediterranean. And actually, disappointingly, last year there was a big randomized controlled trial published in the New England Journal of Medicine where they randomized patients to the Mind diet versus a control diet. Showed both groups actually improved their cognitive function, and there was no difference between the two. And there's maybe a couple potential reasons why. All the subjects were, I think, overweight and had prediabetes, and they all lost weight. So again, that goes back to the first thing I said. Find a diet that helps you maintain an optimal body composition. That's, I think, a first order thing. So, anyways, that was maybe one of the reasons why. Um, there's a couple other potential confounders, but yeah, it showed no benefit there. Other trials have it seemed to show benefit. So it, it's not as clear cut as I would like to say in terms of this is the best diet. But generally a Mediterranean-ish, I think has the most evidence. The other one that has some evidence and that is a big talking point on social media and among influencers is the ketogenic diet. And keto is it's a really interesting concept because in cognitive decline and Alzheimer's disease, there is a theory called the basically energy imbalance theory or the energy crisis theory. And what that means is we know that the brain, as these disease processes progress, becomes less able to utilize glucose as an energy source. So the theory is, well, hey, if we can then go on a ketogenic diet where we're in nutritional ketosis and there's a low level of ketones in the body, those go into the brain. Brain loves using ketones. And that could potentially be used as this alternative energy fuel to make up the difference. So that's where the theory comes from. In terms of prevention, there's virtually no data in terms of preventing cognitive decline and the ketogenic diet, at least that I'm aware of. There's one randomized clinical trial, lasted 6 weeks. It had 11 participants that were, they had subjective cognitive complaints, but not to the level where they were diagnosed with MCI, mild cognitive impairment, which to me is still like, I don't know, is that really even prevention at that point? But anyways, that's all I've seen. So I don't make anything of that. So I think for keto, if you're 45 years old and you had a parent or a grandparent or someone that had Alzheimer's or some other form of dementia, and you're saying, what should I do to prevent this? Keto is not the answer. We just have no data for that. Now, totally different when you are the patient or your parent or someone loved one is the patient that has mild cognitive impairment or early onset Alzheimer's. Um, Totally different. So there's a lot of research that's been done on that. I think the best summary was from a meta-analysis, which basically looks at all of the clinical trials. And this specifically was a meta-analysis of randomized clinical trials. We're not looking at animals and test tubes and observational. We're just saying of the clinical trials that have been done, how many of those have been done on ketogenic and cognitive decline, and what did they show? They found 10 randomized clinical trials. In general, the length of these trials was not that long. It's 3 months to 15 months. So it's not something where we have 3 or 5 years of data, unfortunately. And it did seem to show in general an improvement in something called the mini mental status exam and other cognitive markers. So I think that's positive. That's encouraging. The downside is, and almost everyone's aware of this, but the participants did have an increase in their triglycerides and in their LDL on this diet. It did not differentiate between those who have one or two copies of the ApoE4 gene versus those who did not. So, a different meta-analysis, this was published last year, separated those two out. And they concluded, somewhat similar to the other one, that in those that had no copies of E4, that there's probably some benefit there to the ketogenic diet. To those that do have a copy, one or two of E4, it seems like there is not, or at best, the effect is diminished compared to those that do. Now, they hypothesized, and other papers have kind of hypothesized, that those people with ApoE4 have mitochondria that doesn't function quite as well. There's one pathway called the PGC1 alpha pathway, and that seems to be impaired slightly in people with E4. So there's a whole bunch of other changes too in terms of lipid metabolism and other things that does. But if your mitochondria are not functioning as well, and that's where the ketones are coming in to be oxidized and to turned into energy, the theory, or one of the theories, is that even if you get into ketosis, or if you are supplementing with exogenous ketones, which is basically a supplement that you just take, that perhaps the E4 brain is not as able to take advantage of those ketones and to make up that energy gap. So that points more towards, something we're always working on with our patients, especially in E4, is how can we increase the number of mitochondria, the size of the mitochondria, the efficiency of the mitochondria. And we talk about zone 2 exercise and some forms of fasting. Fasting actually activates that pathway, that PGC1 alpha pathway that's impaired. So, yeah, I think, I guess if I had to summarize on keto, I would say for prevention, there's just no data there. And there is data for Mediterranean and these other things. So I think that's a mistake to do that for prevention. For treatment, if you have a copy or two of the E4 gene, again, I think that's a mistake for multiple perspectives. But I guess the main one is just the data is not, it doesn't seem like there's much of an effect there. And if there's other diets that, like Mediterranean, which there potentially is an effect, then by doing that, maybe you're missing some benefits that you could get. But for those without E4, it's, I think, worth considering. And I would love to see a trial of, kind of Mediterranean versus ketogenic in those that are E4 negative. That has not been done, unfortunately. But those are kind of my considerations for keto.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.